So my first 1, 2, 3 spoke completely fine. And then my fourth, we couldn't understand a word she said.
Okay.
So she was 3, 4 years old, and it was like, and we would look to the oldest child, what is she saying? And she would interpret her. Welcome to the Dr. Thornburg Wellness Podcast, where pediatrics meets functional medicine, blending science-backed insight, common sense, and a touch of shamanic wisdom from a father of 8. Hi, I'm Dr. Brian Thornburg, and I'm here with Emily Ring, and she is a speech therapist, and we want to talk about speech development in kids and answer some questions that some of our subscribers have had. So welcome, Emily. Thanks for coming.
Thank you for having me.
So you're also a mom in the practice, and so yes. How many kids you have?
4 kids.
You have 4 kids,
yes.
and I asked that because, once you get past 3, it's kind of like people are like, wow, you got 4 kids.
Yeah, you have a lot of kids.
You have a lot of kids.
Yeah.
And the ages are?
5, 3, 2, and a 6-month-old.
So yeah, every 2 years or so.
Yep.
Yeah.
So if I double it, I'll be caught up to you.
Yes, you will. Yeah. It's fun. I love having big families,
yep.
and big families definitely parent differently
Absolutely.
than families that have 1, 2, or 3 kids, mm-hmm. because the dynamics are completely different.
Yep.
But it's a great experience. I love, especially now that I'm out of the woods, the tunnel. The first 5 years you're in the tunnel.
Yeah, you really have to take it a day at a time and not just be consumed with each moment, but really try to zoom out and see that these are the good days.
Right. Well,
yeah,
they are the good days. And
yep.
sometimes I remember I'd call up my friend who was one of 7, and I would say, I'm going to have your parents do this when I was in the middle of it.
Right.
And there's like, you just go a day at a time.
Right. Every day, at the end of the day, I feel like me and my husband look at each other and we're like, wow, it really was such a good day. But when you're in the middle of it, you just feel like your mind is all over the place.
Right, so, yeah. And I call those first 5 years the tunnel because they need
that's exactly
so much. That you're there's only one way to move, which is just keep them safe and
keep them alive.
Yeah, keep them alive, and maybe they get a bath today, maybe they don't.
Maybe not.
Yeah, but it's fun, and now that my kids are older, it's so much fun just watching them interact with each other, and then how they keep the other one in check, because they share information with each other. And you don't know about it. I mean, there's a whole nother world that goes on after I go to sleep.
Yes, exactly. Yeah. You don't have to micromanage once they get to a certain age. They really take care of themselves, which I feel like that's going to be hard to realize when that shift happens. Like because you feel like you're so consumed with them. And then once they get to a certain age, then you're realizing they can function on their own.
Yes.
So I feel like that's going to be a huge change for me.
It is. And I call those, that's a different discussion, but I call those parenting traps that we are, especially with the first kid, you're just used to them feeding 3 ounces every 3 hours.
Right.
And then they eat 4 meals a day and they eat everything that you present to them. Mm-hmm. But then there comes a point where they mature more and they become more like us, where we don't eat 3, 4 meals every day.
Right.
And we don't do the same activities every day. Mm-hmm. And if we did, we would be really uncomfortable.
Right.
And we forget that they evolve into being more like us, but then we're like, oh, they're not eating. You're not eating.
Yes.
Well, it's because you're not intended to eat like
Right.
that as they get older.
Right.
But we still keep that reel going in our head that, they're still a baby and they have to eat like that. And,
especially with the first one, I feel like you're so involved and you feel like you're teaching them everything that they know. Like you taught them every single step in their life. And then once they have a sibling or 3 siblings or 7 siblings, they learn so much from each other too. Like I feel like my second one, I was like, how is she so smart? How is she so smart? Compared to my first one, you're, teaching them everything. And so I totally understand that.
And that goes both ways, because sometimes the second kid, and it depends on their temperament, or the third kid or the fourth kid, they will, I have somebody that can teach me and I can move along faster, and that would be one temperament. But the other temperament that you see is that they'll do it for me.
Yep.
Why should I do it?
I don't need to speak.
I'm just going to sit back.
Yes.
Yeah, I'm just going to, bring it to me.
Yep.
And so, but you see that in speech, which is a good segue into speech. So my first 1, 2, 3 spoke completely fine. Mm-hmm. And then my fourth, we couldn't understand a word she said. Okay. So she was 3, 4 years old, and it was like, and we would look to the oldest child, what is she saying? And she would interpret her. And so that went on, and that was my first experience with speech therapy. So my 4th kid needed it, my 5th, my 6th, my 7th, and my 8th all needed speech therapy.
Okay.
And I was confused by my children having to need speech therapy because I don't have speech impediment.
Right.
Mom doesn't have a speech impediment. We're both highly educated. So why was this happening? But that was the third one was teaching the fourth one.
Exactly.
And it wasn't the parents as much speaking to the child because now there were too many kids. And so they all
especially when it sounds like what you're saying was intelligibility. You couldn't understand what she was saying.
Not a
but
word.
I bet her language was great, or his, or whoever it was. And that happens so often when they are trying to keep up with their siblings, or sometimes they're trying to keep up with their parents, and they're trying to talk in an adult-like way, but they don't have, the structure yet to do that. So everything is jumbled together and you can't understand a word they say. So that we see that all the time where it's, they have the language. It's just they're trying to speak like an adult. So their pace is faster. They're running everything together. So if you can just kind of work on breaking that down a little bit, normally you see a ton of progress really quickly, especially if you get started early, which it sounds like you did.
It did, yeah.
Yep.
So let's talk about what is a speech therapist, and then probably adult versus pediatric.
Yes, absolutely. So a speech and language pathologist, I specifically work in pediatrics. So when we bring in a child that has needs, we look at speech abilities, language abilities, and we can also do feeding, different things in that nature. But speech is kind of like what you and I were talking about. So that is related to intelligibility, fluency, that's under that speech category. So it's more articulation, how they're producing their speech sounds, overall intelligibility, that's under that speech category. And then language is more all-encompassing. So we look at expressive language, which is the words they're actually saying to us, their overall vocabulary, expressive language. Receptive language is how well they can understand the different things that we are saying to them. And then there's also social language. There's play skills that we look at when they're younger too. So social language is obviously how they engage with their peers and also with adults, familiar adults.
Would that be nonverbal language, or what do you mean by
social language? So that's really how they're interacting with the conversational partner. But then along with that, so you're talking about gestures too. So that can be a form of expressive language when they're using gestures, like more. That's, more, milk, all done. Those are some, even help me is some of those early signs we see a lot with kiddos that are, under 2, under 1. We can use those gestures early on so that they're understanding, okay, to get my wants and needs met, I have to do X, Y, Z. I don't get to just go and get what I want. At a certain point with my kids, like we can start using even hand over hand for sign as young as 6 months, especially once they start eating, because when they are really engaged with food, that's always a great time to start because they want to eat. So you can encourage them to use functional signs in that way. So that's really a form of expressive language, is those gestures as well. But anyway, so we look at expressive language, receptive language, social skills, and then also play skills, because that relates to cognition. And lots of kids learn through play. So we look at all of those different areas when they're young.
Okay, good. I'd like to break down that a little bit more.
Yep.
Now, so and I'm jumping ahead a little bit here, but just since you mentioned it with signs, so, typical word development, 1 to 2 words by 12 months old, 4 to 6 words by 15 months old, 10 to 25 words by 18 months old. But that can include a sign word.
Yes, absolutely.
So doesn't have to be a verbal word.
It doesn't have to be a verbal word. Verbalization. It
Right.
can be, like you said, a gesture or a sign.
Or it can even be, I don't know what the actual English class word is, but when you make like woof woof or meow, I forget what
environmental sounds.
Environmental sounds.
Absolutely, yeah.
So that's also considered, because there's an understanding between two people.
Right, exactly.
Or even if it's a mispronounced sound, for instance, I'm half Spanish, I couldn't say abuelita,
right.
So I said tita.
Yes,
So
absolutely.
tita
and that's
was
a real
grandmother.
word. Yes,
right.
that would count as a word.
So I just want parents to understand that it doesn't have to be a strict, like, they say dog, clearly, it could be wolf or something.
Lots of times we see that they say the same, especially when they're using the same approximation for the same word every time. Like dog is ga. Every single time they're saying ga, ga, whatever it may be, that means dog. That counts as a word.
Right.
It doesn't have to be dog, perfectly pronounced, especially 2, 3, and under.
Yep.
Doesn't have to be 100% the perfect pronunciation.
Perfect pronunciation.
Yeah.
And let's just quickly go through intelligibility to a stranger.
Yes.
At 2 years old.
50%.
That's what I say.
Yes.
3.
maybe 75% to 90. And then, 4 years old is when they start to be more intelligible to a non-familiar listener.
Right.
So really, when we see a lot of intelligibility, we can start, like, I like to listen to it around 3, because 75%, like, they should mainly be, you should be able to understand them. But really 2 and under, you're trying to figure out what they're saying, and it's totally normal for them to be more unintelligible, especially to non-familiar people.
Right. And then 4 years old typically is, pre-K 4, and the children are starting to be more socially introduced outside of the home, and more in a structured setting. And so that we would expect there to be greater fluency and intelligibility and understandability.
Well, and that's why we'd want to start working on that at that age, because lots of kids, that has to do with their confidence too. So we want them to be intelligible not only to, like, mom and dad and their teachers, but we want them to be confident enough to engage with their peers. And if their peers can understand a word they're saying, then they're going to get more frustrated or more reserved. And that's why we really focus with my practice. We really focus on that 0 to 5, the birth to 5 age range, because it can really affect development, forever later on. Because if they can really work on that intelligibility now and gain the skills to, the muscle memory to produce those sounds and to be more intelligible, that's going to affect their confidence and their willingness to engage. So it can really affect their personality.
That's a good point.
Yep.
And when would a parent, because I'll have parents concerned that their child's not speaking, or they're not fully intelligible, they're in pre-K 3, and some of they're not doing the sh sound or some of the blended sounds.
Yes.
And I'll say, don't worry about it.
Yes, absolutely. Especially with those harder sounds and blends and R's and L's. Like, most kids are going to say wed for red,
Right.
But I really look at, when they're younger, I look at how are they engaging. So even with, babies, we're not going to be working on speech sounds and language with a baby. But what I try to look at is, are they tracking? Do they look at my face? Are they excited to see me, especially at 3 or 4 months? Are they smiling? Are they engaging? And really with, that birth to that 2 years, I'm really concerned. I'm looking at that engagement piece.
For what, autism or
for families that are concerned about a speech and language delay. I'm not as concerned about, can they say the TH sound? I'm more concerned about, are they wanting to engage with you? Do they want to engage with peers? Are they wanting to play, or are they very self-contained? Do they look every time? Not every single time. Not every child is going to look every time you call their name, but are they going to realize what their name is? And every child's going to ignore mom and dad once in a while, but do they at least acknowledge that their name is being called?
It's a 6-month skill.
Yes.
Yeah. So after 6 months old. So I just clarify for families that are not expecting a 4-month-old to
No, absolutely. Even after 6 months, really. But we just want, especially in that 1 to 2 to 3, I'm really looking for more engagement.
1 to 2, 3 months?
No, that
years old.
Years.
Yeah.
Yes.
Yeah.
Especially 1 to 2. I'm looking for more social engagement, and that will cue us more of, there's things that we could work on versus, they can't say TH and R. We're not that concerned about that.
Okay. Yeah, right.
If that makes sense.
Yeah. So we're looking at, it's like landing a rocket ship, like what Elon Musk did with the, landing on those 2 little stakes. It's at first it's we're just coming in, so we're looking at the global aspect.
Exactly.
And then as we as the toddler should start to have more words, then we're looking for more specific sounds.
Right. And I think it depends on the parent too. Sometimes you have parents that are very, aware, and they want to know, does my child need speech right now? And then you also have parents that have no awareness. So I think kind of zooming out, that's one of the things that we try to do, is we try to zoom out for families and create a relationship so that they can feel open to ask those questions that they don't know, and we can help them navigate what their child needs or doesn't need,
Right.
So
is there a point, and I'm not taught this in my training, and I don't, maybe it is in yours, that a child would look at a mouth moving to...
So I would say once they start really seeing your face, so I would say 3 to 6 months, that age range, I wouldn't say they directly look at your mouth, but they are more engaged with your face. And that's something you can look at right away with that 3 to 6 month age range. is especially recognizing mom or dad's, but mainly mom's face. Yeah,
right.
that's something that you can that's one of the first things that we can see in terms of language development and engagement. So.
Yeah. And now, so I'm going to start with birth and I'm going to kind of move forward and I want to make sure that I talk about, the language difference between boys and girls is when we get to the point where we can bifurcate those two, because boys and girls certainly will speak and use words differently.
Yes.
I always say that girls are more verbal and boys are more mechanical. And so there was one of my first experiences on that was there was a birthday party and it was like 4-year-old and it was a girl's house, a little girl, 4-year-old's house. And the 4-year-old boy from another household comes into the backyard and there's a fence around the backyard. Boy takes a look left, right, and then jumps the fence. And the girl who lived there goes, "You can do that?"
Right.
So the boy is probably not speaking at all, but he's like immediately over the fence.
Yes, that's exactly right.
Yeah. So anyways, we'll get into that in a second. So at birth, again, typical term, infant, not premature infant. Explain how the mouth works at that age versus after 6 months old, because at 6 months old, they start to use the front of the mouth. Before 6 months old, it's all back of the mouth with tongue thrust. And
absolutely.
So explain that a little bit.
So those first 6 months, it's more about like feeding and breastfeeding. So their tongue positioning is forward because they're trying to latch. And then that's why we kind of start feeding at 6 months, because we're looking for that reflex, to not be so protruding in the front of their mouth. And that's when we know it's time to start eating. So at the first 6 months, it's more about like breastfeeding with the positioning in the mouth. And then once, again, 6 months starts, that's when we can start thinking about feeding. And that's when they start moving, more to babbling rather than when they're younger. So 0 to 6 months, you'll hear more of like those gurgly sounds because they're on their back. Their tongue is in the back of their throat. So they'll make we always joke with my youngest, they all have said agoo is like their first little vocalization is agoo, because they're just, their tongue is in the back of their mouth. But then now that my youngest is 6 months, she's starting to do more of like the raspberries with their mouth and the ba sounds, because their tongue, they're not thrusting. So that's kind of a little summary of that. But it starts in the back and then moves forward, but the reflex moves back.
Push the tongue forward, which helps pull milk out of a nipple, whether breast or bottle nipple. Right. So it's more, when they're under 6 months, they're more on their back, but once they are 6 months, they're moving around. They're not, everything's not pushed to the back because they're moving, they're on their belly and they can crawl around. And so just to go through that, the rest of the body is at 2 months, they have head control. 4 months, they have diaphragm up control. Arms are working. They're starting to rotate. So that means they're flipping and front to back to front. And then at 6 months old, they're coming into their hips. So they're sitting or they're tripoding. And so now their tongue's not dropping into the back of the throat anymore because they're not on their back.
Right.
Babies under 6 months old love to be on their back. They don't really enjoy the front experience. And that's not because that's how we're programmed genetically.
Right.
That's the back to sleep program. Whereas my generation, we were all put on our bellies. And so we all enjoyed our bellies. So it's more of conditioning that they like to be on their back. But after 6 months old, you never see a baby take on the world from their back position. It's always they're always on their belly, because that's how they start to move, and then that drops the tongue forward. But the reflex is independent of all that. The reflex, I say reflex. The reflex is independent of all that, which is pushing the tongue forward, even though they're on their back. The tongue is still forward.
Right.
When they're actively engaging their tongue to nurse.
Right. Right.
Yeah. And then the reflex goes away. 6 months, they can start to eat solid food, and because they won't spit the food back out at you. Because if you try to put a spoon in their mouth before 6 months, they'll just push it back out, right back at you. Okay, so then after 6 months old, they're moving from back of throat sounds to forward mouth sounds, which is why they raspberry. They start to hit consonants, because we make consonants at the front of our mouth. We make vowel sounds at the back of our throat. And so now they can start to make some consonant sounds and sort of.
So the first ones we typically see is the bilabial sounds. So like b, p, w, all those sounds that not only are at the front of your mouth, but that they can visually see. versus to, k and g. And also vowel sounds are some of the first sounds that they make just because your mouth is open and you're able to make those vowel sounds. But those bilabials are some of the first consonants.
And bilabials will be lips together.
Yep, lips together. Yeah. So b, p, w even because they're not together, but they're using your lips.
And that's why they would say ma,
yep.
before they say da,
da. Yep.
Right, yeah, because the tongue has to flick.
Yep.
Yeah. So where would there be any concerns that a parent might want to pick up from that birth to 6 months before they start making the consonant sounds? Is there any warning signs that you're seeing other than the global engagement? Is there anything?
So that's the first one. But also we see a lot of families that come in for like a latching difficulties with breastfeeding. And that's more of a multidisciplinary approach. When we see that, we can consult pediatricians and lactation consultants, but lots of families will come in with that concern where they're getting a lot of spillage out of the side of their mouth or they're unable to latch. So that's obviously something that you can come and consult a speech and language pathologist for. But really the main thing for that birth to 6 is will they engage with you visually, and smiling is another big thing as well. So
let's get into the latching a bit. Okay. So for me in my training, it was speech therapists would work that. And then maybe a couple of years ago, somebody says, well, I'm going to go see an occupational therapist. And so there's obviously some territorial.
Right.
Yeah. So I was surprised, like speech therapist does suck swallow issues. And so can you explain that? Because I was surprised to see an occupational therapist in the territory.
Well, I think with speech and language pathologists, we look at more of the function of the mouth. So like the tongue positioning, the swallow, is it safe for them to swallow? We look at the swallow mechanism. Are they coughing every time they're feeding, whatever it may be? But I think the occupational therapy realm is more in the sensory component. So there are kiddos that have a difficult time latching when there's too much stimulation. So I think that's where occupational therapy kind of comes into play there as well. And I also think that there's so many different aspects that a speech and language pathologist can work on and an occupational therapist can work on, that it really depends on who you find. If you find somebody that really specializes in breastfeeding and they happen to be an occupational therapist, and they're making progress with that occupational therapist, then go with that.
Right.
Or a lactation consultant. Lots of times when children are born in the hospitals, that's the first specialist they see for breastfeeding is a lactation consultant. Or it may be that there is a speech and language pathologist that really specializes in breastfeeding. So I don't think it really matters as much as people make it out to be. And I think the bickering kind of takes away from the therapy in general, where once you find somebody that you trust and is effective for you, I think that's the way to go.
That's the right person for you.
Yeah.
Right. It's more about the relationship. And are they moving the ball downfield?
Yes.
Yeah, they get the results.
The results.
Right.
Exactly. But I think that the waters get muddied because occupational is more sensory based, but speech and language is more the function and in the entire mechanism. So that's where the waters get crossed there.
The salt water, fresh water mix.
Right. Yeah. Brackish water.
So what the lip tie, labial ties, tongue tie.
And we've talked about this as a mom in your practice.
Right.
But I know that when we spoke, there's so many, we see it a lot more now. And I think that really is just because we're more aware of it, I think. But for me personally, I see it less as like, I could see a kiddo that maybe once I do an oral mechanism exam, I see that they have a tongue tie or a buccal tie or whatever it may be, but is it affecting anything? So are they able to still produce, like we call them alveolar sounds? So t and d, are they able to say that? Or are they able to say th? Is their tongue able to move enough, their lingual mobility, good enough for them to be intelligible or to produce all the sounds they need to make or to swallow effectively? And if so, there's nothing, you don't really need to address those things, in my professional opinion. It is something to be aware of, especially with, if you're having a lot of issues with latch, That is something that, again, is a multidisciplinary approach, because sometimes you can just work on stretching, movements, or if it's something that maybe a dentist that is, specializes in that, you can consult that as well. But for me personally, if they're able to have that range of motion that they need, then it's not something that needs to be addressed.
From a surgical standpoint,
from a
like
surgical,
a release,
yes,
from
yes.
a release. So that's how I explain it to my families: is do you see the baby's tongue past the lips?
Yes.
Because you will not need to use at the nursing point through 6 months old. If the tongue's passing the lip, the tongue can do whatever it needs to coax milk out of a nipple.
Exactly.
Right?
Yep.
Now and there's really no proper word that we use or sound in the English language that we would have our tongue outside of our mouth.
Other than TH.
I guess that you're
TH
right.
is the main one.
Right.
But other than that, no.
But if the tongue's passing the lips, then you can make your TH sound.
Right.
Right.
Exactly.
So because I just see so many more parents being, or their kids being diagnosed with tongue ties compared to what I saw 25 years ago. Now, I used to release tongues in my practice, and the old midwives used to keep a pinky nail that was long.
Yes.
And what I don't know that they always told the parent, but once the baby would be born, they would sweep the baby's mouth.
Wow.
And use their pinky nail to release tongues. I mean, this is going way back. I don't think they do this anymore. but again, we don't know if it's happening more with midline defects or
or just awareness of it.
Or just more awareness of it.
Well, and I think I'm obviously the less invasive, the better, just in general as a mom. That's how I think as well. But I actually am grateful, going back to that OT component, because I think a lot of people come in where they have a difficult time with latch, especially if it's their first child, and they think, oh my goodness, is there a tongue tie or a buccal tie or whatever, a lingual tie? And they're trying to look for how do I solve it right now? Rather than, if you take that sensory component, I just know from being a mom of 4, some children need a private space to be breastfed, and some kids you can breastfeed wherever you want and they're totally fine. And so I think also realizing that it's a whole picture. It's normally with breastfeeding issues, it's not just oh, okay, there's a lingual tie, let's cut it and it'll be fine.
Right.
I think you really have to look at a child in a holistic way and try other strategies, like going into a private room, or even just working on positioning. I think a lot of times we just assume that moms know exactly how to breastfeed because they're moms, and that's
what we're supposed to do.
One of our purposes on this earth is to be able to do that and keep babies alive to be able to do that. But you have to be coached and know how to do that sometimes. So I think that just looking at the child as a whole and not trying to do a one quick fix shop with that.
Looking at more. And like we said earlier, as the kids change, the infants change as they gain developmental milestones. So I'll have a child or infant that nurses fine, and then after 4 months old, they're like, what's that?
Exactly. Or pounding the mom as they're...
Yeah. And I'll say you need to go into a black room,
Yep.
into a closet, so the child's not distracted.
Yep.
And because, again, just temperaments and, oh, what's that? What's going on? And they'll start pulling off all the time.
Yep.
And that could be uncomfortable.
And just experimenting with positioning is such not easy, but something that you can try right away. If they're not able to latch with you holding them like this, like trying the football position, or even I know with my first one, doing more of the skin on skin, because that's very natural for them, and that's releases hormones for them that help them staying latched. So that's something else too.
Which is more global and not
right.
necessarily speech or
exactly. Just more of advice.
It just feels better.
Yes.
Yeah.
Right.
And it's
exactly.
just tactile and creating more awareness.
Yes.
Now, with premature infants, we have preemie nipples. So I guess let's talk about preemie nipples or preemie pacifiers, and then into the different shape pacifiers.
Okay.
So preemie, they have a harder upper aspect, I believe, because their palate may not be.
Right. Well, let me just think about how to answer this question. So, you're asking what would be better for a preemie than...
No, what's the difference? Because I know like like a preemie nipple, if you're bottle feeding, or a preemie pacifier tends to have a harder top. So when the baby...
I don't even know that.
So yeah, like maybe, yeah. So in the NICU, we'll have a preemie nipple when we're feeding the baby a bottle, and it's more rigid because it gives them a harder surface to smack
to have
against.
that. Yeah, okay.
Yeah. So we'll just skip that part. Yeah, we don't need to go into like baffle the speech therapist.
That'd be great. Yeah, thank you.
Yeah. All right. So then after 6 months, they stop the tongue thrust, the primitive reflex, and then they're able to start to take foods. I like to look at infant development, ages and stages, to guide us as parents on how to approach our children.
Okay.
Because one of the like you mentioned, moms, we're supposed to nurse, or we should there and just know how to nurse,
right?
And do this just like a penguin doing whatever they do with their babies. Like it's just like we just do it,
Yes.
but it doesn't always work out that way. But so I like to look at the question of like, what are we doing as parents? Because we've lost multi-generational homes. It's not as vogue to have unmarried aunt living at home anymore with the extended family and the multi-generational home. So we don't have this wisdom passing down, and people then, my hometown's up in Indiana.
Same.
You're Indiana.
In
okay.
Indiana.
Where?
Yep. Muncie.
So
Ball
State.
Yep.
Yeah, Ball State. Yeah.
Yep.
Northern
Go
Indiana.
Hoosiers, though.
Yeah,
this
right.
year.
That was great.
Right? I know, it was great.
Yeah. And we were against Miami, which is my other hometown, because I moved to Miami when I was 11 or 12.
Wow.
So,
were you conflicted at all?
I went with Notre Dame. I mean, I'm sorry, IU. I went with IU.
You have to.
Yeah, because Miami's had their time
They've
in the sun.
had their fun in the sun. Yeah.
Yeah. So it was IU's time.
That.
Yeah. Yeah. It was for no other reason than
it was their time. Yes.
Let's spread everybody's happiness around.
Yeah.
So we've lost these multi-generational homes, and so there's wisdom has been lost, and we move away from the home, from our hometown, and so we don't have mom there or grandmother there, and so that raises the question, like, what are we doing as parents? And so what I really like to counsel my families on is, well, if a child, once they gain a milestone, we have to let them live in that milestone, and that's difficult for a parent sometimes, because you're like, I'm afraid my kid's going to choke, because solid foods typically start at 6 months old.
Right.
And I mean, I've been doing this for a long time, and unless they're fed something inappropriately, inappropriate sized food, or they'll get something in their mouth that they're not supposed to have in their mouth, then they choke. But generally, they don't choke.
Right.
When
it's
we have
pretty normal for them to be gagging and coughing,
and they'll cough it out, or and so it's more on the parent side to
be aware of that,
to be aware of that, and then encourage them to eat solid food. Now, this is so let's get baby-led weaning versus purees.
Yeah.
Okay, I certainly have my opinion on it. What do you think of that?
I believe in purees, so I think that if you just put a banana or whatever in front of a baby, that's not going to be. That doesn't go with what their mouth is doing, and that actually can be dangerous. But I also do like a mixture, so I like for them to have that sensory experience when they're 6 months. So I think, when I have my 6 months start, baby start eating, what I'll do is I'll get more of like a puree, or I'll take a carrot and I'll boil it and I'll make it almost like a puree, where it has a little bit of texture, but I'll put it on the plate in front of her. Right now, she's my youngest, she's a girl. So she can play with it as I spoon feed as well. So it's kind of mixing those two modalities so that they have that sensory experience. So they later down the road, it's okay if they have food on their face. They can lick it off or whatever it may be. And they're having that sensory experience, which feeding is a lot about this sensory experience, and the experience with, feeding is something that should be enjoyable. It should be making a bad feeling, hunger go away. It should be something that is social. So eating with them is a huge part of it as well. So what I always try to do is I try to sit there, and even if I'm not hungry, like I'll pretend to be eating, or I'll have like a little bite of something. So because that's what eating is. It's a social function as well. So that sensory component, social, And then obviously the actual eating, so I'll use a spoon. But like I said, I do like to use purees as well. I don't think that it's really appropriate for a 6-month-old to be having like a full steak in their hand or whatever it may be. That's where you actually can get dangerous, where they actually might be choking if they're eating those things. So that's kind of my opinion on that.
I agree too. I think that there's this, going back to what are we doing as parents, when I see someone who is either just overly concerned about allowing the child to move into their milestone, playing on monkey bars because they might break their arm, or eating solid food, or they hover over them as they start to walk instead of letting the child make their oopses and fall and then learn, is that the parent is, or the other side where they're giving them too much freedom. There's no boundaries, and the kid can wander wherever they want in the house, and the parent. So whenever I get these extremes of too much control or not enough control, my interpretation is that the parent is reliving their own childhood by trying to correct things that they feel that their parents didn't do for them.
Yes.
And so
that's where that generational wisdom really is so beneficial.
Yep. Yeah. And then, but unfortunately now, and I see this a lot, is there's conflict between the child, like the adult child with the baby and the grandmother, and so the multi-generational home, since it's not consistent, and they move away, and now there's just like, well, this is my baby, this is my time to do this, and you already had your chance.
I can do this.
And I can, don't tell me what to do, and that's a whole other story. But but with the baby-led weaning, I find that there's just this subclass of moms that just want to advance their child beyond their milestones.
Yes.
Like to make a very crude analogy, it's like taking your 4-year-old and putting makeup on them. It's like I want you to be older than you actually are, and so that's. Whenever I hear that, I'm always the baby-led weaning, and I've gotten into discussions online with advocates for baby-led weaning, and they'll quote some of the research to say, well, this is beneficial because it works, fine motor skills, and they get different textures, and they give all the arguments. And so I went and looked up the research, and they're cutting off the second paragraph, which says, if you're going to do baby-led weaning, you should take a CPR class. Right. So they're not explaining the danger side. Right. Yes. And so I'm not a fan, because I don't think that historically we have taken an infant, strapped him to a high chair, and then fed them foods, because historically food was scarce. Right. It wasn't. I think our current modern world has an abundance of food compared to more 100 years ago, 50 years ago, and so we didn't waste food, especially for the baby. That would wouldn't be part of the culture. And so the idea that we're clipping a baby into a high chair, again, we have to assume that the baby has abdominal muscles and can sit up on their own. That is necessary. Besides the tongue thrust,
because then all they're worried about is staying upright if they don't have the muscles to do that.
Right. It's
and that's not safe either.
Like trying to learn to ride a 2-wheel on a really windy day would not be now I'm trying to navigate the wind and take a balance. So the baby has to be able to sit up on their own without falling over. The tongue thrust has to stop. So I forgot what I was just saying.
You were talking about how generationally we had scarce amount of food.
Yeah, scarce amount of food. So the idea that we would give a baby a big piece of food and a lot of it would be wasted, it just doesn't make sense from a historical perspective.
Yes. And, I absolutely agree with that. And I think that's more of a generational thing in general, is that we are trying to push kids to be, achieve their milestones and move on past that, and be 5th graders when they're only at second grade level. And I think that carries down to even what we're talking about with baby-led weaning in that way. So
yeah, and I think you could even say, like, you'll have some parents say, well, they're already doing flashcards at 2 years old. Just like, you had you had the appropriate reaction. Like, that's ridiculous.
Well, that's why, I love what you said about thinking about children more during like ancient times, like when, we didn't have all this food to be giving them. I try to relate everything. That's why I don't always talk a ton about milestones. I try to look at each child. You have to keep them in mind, obviously. You have to know the milestones, what they should be doing. for their age, but taking each child as their own self and looking at them as a whole is so important, rather than trying to push them past these milestones where then they're not really even enjoying their childhood because they're constantly being pressed and
performative.
Yes. Right.
Yeah.
And they feel like they get positivity from the parents when based off things that they do, not who they are.
Right.
And so it's a whole kind of other conversation, but
that over controlling parent or under controlling parent,
yes.
it falls back into those two groups, and
yes.
like, well, I need to have this child perform because that's going to get, and typically that'll make me feel as a better parent that I have a smart child, and look at what my kid can do compared to your kid, and,
right?
And it feel that now there's, which and I know we're digressing a bit, but the Western country that performs the best on academic standardized testing for like 20 plus years, and I don't quote me on that number, but it is decades in the making of every single year, is Finland. They outlawed all tests for any child under 18 years old. School is all play-based and project-based, and you cannot test a child until they're older than 18, and that's when they go off to college.
Right.
And they perform the highest in all of Europe, against the U.S., against Japan, against everybody.
Right.
And it's all project play-based learning. And you mentioned earlier, that's the key ingredient.
Of cognition, yes.
So it's not flashcards. It is, let me play with you. Now, you could weave in some colors.
Right.
Like, let's get the red car and bring me the blue car. And now the child's playing to learn the colors, as opposed to be more performative of, what's this?
Yep. Well, that's actually exactly at Ring Therapy. What we try to do is we try to not only look at the child as a whole, but integrate that it's very family-based. So we have to incorporate the whole ecosystem of who's involved in that child's life and train them as well, but then relationship-based too. So you work on building rapport with that child and incorporating goals into their likes and what they want to play with, in what is available for them in their environment, and incorporating the goals into those things, rather than sitting and saying, okay, let's say L sounds. Let's go on to the next thing, where you're not building any relationship. That's not going to be functional because they're not going to apply those strategies in real time. So there's that component of, we have to build a relationship with the child, but then we also have to, once we learn the strategies that really work well, we have to train the parents on how to do those things, because like you said, we don't know everything. And I think with social media and everything that's in our ears all the time as parents, we think we should know everything. We think we should know exactly the words to say all the time, and exactly how to target, these speech and language goals and these milestones, but we don't know everything. And I think that, so first we have to work on building that relationship, implementing goals that need to be targeted into play, but then also teaching the families how to target those things. And lots of times with that 0 to 5 age range that we kind of specialize in, it's more about the parents don't know how to elicit language from their children, or how to set up a room to promote language use, or how to maybe don't speak when you want your child to start speaking, and rather than, we're told to narrate everything and we're told to talk all the time, but sometimes kids need that back and forth. So giving them a chance, like you talking about what you're playing with, and then giving them a chance to say something back, and expectantly waiting for them to say something back. I mean, I do that even with my 6-month-old now, is I'll make some really fun sounds and she's really engaged and she's smiling, and then I'll just wait and be making eye contact with her. And it might be 10 seconds down, but then she'll make a sound. And that is the start of engagement and expressive language. So I think a lot of it, just to go back to what we were saying, is that building relationship component into real life situations, and then also helping the parents to know the strategies that work for those things. So
right. No, I like, that's all great advice, which brings us into the question that Mom asked. So I'm going to.
Yeah, absolutely.
So I had one of the moms that subscribes to the Instagram channel asked this question when we announced that we were going to have Emily on, a speech therapist. It says, I'm concerned about my 18-month-old's language development. She knows many words when asked to identify objects or people, but doesn't use them in context or on her own. She also doesn't respond with a simple yes or no or call out for help. However, she does use sign language to communicate her needs, such as asking for more or water. She'll also point to objects and say water when she sees someone drinking from a bottle. Is this a normal phase of development or a cause for concern at her age?
Mm-hmm. So to me, that sounds pretty age appropriate. She's using some words she can label. That's actually really good for her to be able to label the different items that she said. And lots of times we'll see them they'll use those early signs to convey their wants and needs in combination with some words or verbalizations that she was mentioning before they start to use strictly words. And the fact that she is, labeling different things, and it's okay that she's not answering yes and no to every subjective question that comes up, because she might not even know yes and no to those those questions. But asking and labeling is a great start, and comes sometimes even before the requesting with words and requesting. So there's requesting for objects, and then, which is one thing, and then there's requesting for assistance, like asking for help, which is a little bit harder. So those are harder skills that I'm sure it sounds like, based off what she's saying, that it's pretty age appropriate for.
I think it was age appropriate.
Yes,
too.
for 18 months.
For 18 months.
Yeah, she's able to label a bunch of things and.
Right, and the yes or no, because they're not little monkeys that are like an organ grinder that's supposed to respond to us when we ask a question. Right. We wouldn't enjoy that experience. Well, we don't. Well, I know I didn't enjoy it when my mom and dad would make me do something.
Yes,
like
exactly.
say hi to this person, or age appropriate. Right. I'm not going to be an adult turning my back to somebody, but
right.
But when I'm a kid, just like, I just want to play.
Yeah,
like,
just
what
let me play.
Yeah. So
exactly.
then
and the fact that she's even using some gestures to request is a great sign too. I mean, she's trying to convey her wants and needs in an appropriate way. So those are all great signs.
Talk about two some that overlap here. So there's 1 to 2 purposeful words at a year old, 4 to 6 at 15 months, 10 to 25 at 18 months old, and then hundreds of words by 2 years old.
By 2, yeah.
And they're picking up one new word every hour or two after 18 months old. So they're really sponges to words.
Right.
And so let's talk about 2 different cases. One, the multilingual home, as a child's learning to speak. And then the second is the home with an older sibling, which both of those can either.
About both, yes.
Yeah. So let's go ahead and.
So just you and I were talking before this started about a child that maybe is an only child versus one that has siblings. And it can kind of go 2 different ways, just depending on the personality of the child. Whereas for me, my firstborn, I feel like I taught him everything he knew, and he was right on schedule with his milestones. But I felt like I was very involved as a mom. And then the second one came along, and she learned everything from my son. And they pick up so much from their siblings in some instances, but then there's other cases where you'll have a child that's the firstborn, knows what their sibling's trying to say, they're engaging with them all the time, and so they just do everything for them. And then lots of times we'll have kids come in that the parents are like, well, they're not talking, but they understand everything they're saying, they can follow directions. It's just that they have a sibling that's doing the conversing for them. So there's 2 different scenarios there that happen. Sometimes you get the second where they're just exploding with language because they have that sibling, and then sometimes you get where they understand every single thing, and they're, especially if that second one is a boy, because like what we were discussing about boys like to be, more engaged with, being rough and
physical activity and mechanical things.
Right.
And,
so we see that a lot with, if there's the younger one is a boy and the older one is a girl, the girl will do all the talking for the little boy.
Yeah.
So there's kind of 2 different ways that can go. And then you were talking about the multilingual home.
Right, where mom speaks one language and then dad speaks another, but they both speak English.
Yes.
Yeah.
So lots of times with those, what I have seen is that the children they're like sponges, taking in both languages and figuring out which ones that they use that they're going to prefer. And so they'll understand everything in both languages, but maybe they aren't using as many words as someone that only is monolingual, it has one language in the home. So with that, what the advice I wish that I could give that to my children, like I think that's such a great gift to be able to give to your children, is to have to be multilingual. And we're one of the only countries that, doesn't really have that.
Practice that. Right.
So I always tell families, keep doing that. Don't worry if they have the exact right number of words expressively, and try to just be consistent in your use of language. So at the dinner table, maybe for every meal, it's going to be Spanish. Like, you're going to speak Spanish at those meals, and they know that. And you're not going to code switch. Like, you're not going to go in between English and Spanish and confuse them. You're going to always use Spanish, or maybe always Spanish at home, or always French, in the car, or whatever it may be. Just try to be consistent and not code switch between, and give them, time. Expressively, they're probably going to be a little bit later using words, but they're going to be understanding a lot, receptively.
So we have to put it back into context.
Yes.
So when I have a family come in, they're not saying, they're not hitting those milestones. Then, let's look, how much are you anticipating the baby's needs?
Right.
And this gets back into the relational aspect, because when you have more than one child, efficiency becomes a dominant driver in your psyche, because you want to get through all the child activities as fast as possible, because there's going to be unexpected events that come up with the kids. And so you focus on efficiency rather than, let me slow this down so my child can develop their language. So one of the questions is like, how much do you anticipate? Do you hand the bottle before it's lunchtime, before the baby asks for the bottle, or the toddler asks for the bottle? Yeah, I do that. And then you have 3 different types of food ready before they happen.
Yes. Do they have to communicate for any reason, or are you doing everything for them?
Right.
Absolutely.
So we have to understand what us as a parents bringing to the table, because
that's why that parent education piece is so important, especially. Like we mentioned, kind of you have the parent that could be way over involved doing kind of everything for them so they don't need to speak, or you have a parent that is more hands off and lets their child, engage in the toys that they have at home or whatever, but maybe the room is set up like their playroom is, they have all these toys all the time and they have access to everything on their own. So why would they need to communicate or engage with the parent, because they have everything right there for them? So sometimes with that, in that scenario, what we might suggest is like set up some of their most preferred items like a little bit higher, so they have to engage with you to have access to those things. So, I mean, that's a really quick, easy way to promote language with those younger ones, is don't give them access to 100 toys all the time on their own. Have them, need to engage with you. Or same thing with, I kind of go both ways with this, but with like access to their cups and access to their plates. Or I don't give my kids access to snacks because they would just be snacking at all times. But I do allow them to have more of a role in like, I want you to fill up your water, because that's just teaching them skills that they need to know. And rather than saying, did you get your water? Telling them, hey, what else do we need before we leave? What do you need for the car? So having them walk through those steps cognitively to figure out, those things on their own, which help them to become more independent. So it's a fine balance with that, but that kind of mixes in parenting with the speech and language there.
Right,
but,
which is
what we do.
What we do, exactly.
Yes.
So would you agree with this? So once in a while, boys are later speakers oftentimes, and they may not hit the classical word milestones.
Yep.
And if I have a boy that is on all other metrics doing fine, but just not saying words.
Right.
I'm like, I wouldn't refer the child to speech until they're 2.5.
Right.
2.5.
Oh,
Is that?
Well, especially for that case that you're saying. Yes. Unless you're seeing where when they are talking, they're super unintelligible, because there's things that we can look at for that. But it's not something that, like what we were just talking about. Boys like to be more involved in physical activity and movement. And if they're socially engaged, if they can understand us, and maybe they aren't using 200 words, but they have a good amount. Like we want them to have at least, a decent amount of words. We don't want them to be nonverbal at 2.5. But that's okay if they're not at the exact milestone. because they're engaged in other things and they're growing and developing in other ways. And with them, that's what their preference is. So
yeah. So just understand for the parents that there's not a hard endpoint where we're like, oh, this is a bad problem. Because we have to take it in context of the larger environment.
Yes.
And now we talk about 2-year-olds having hundreds of words. Is it 2 is when developmentally they are able to have shared experiences. I don't call it play because they're not actually playing with. Playing requires delayed gratification, and a 2-year-old really doesn't have the concept of delayed gratification. But they will start to interact with each other. Like maybe they're both at the little play kitchen and they'll pass a cup or a plate, but they're not really creating imaginary.
A friendship,
they're not creating an environment. So that's why language is really important from that. They stop putting things into their mouth at 15 months old because if I'm putting objects and I'm still tasting my world, you can't say words at the same time. It's one or the other. And so that's why there's 1 to 2 words at 12 months and 4 to 6 at 15 months. And then after that, the words start to explode out. And there's a reason they're putting things in their mouth, which is a separate topic, which is they're desensitizing their immune system against what their environment's like. So then at 2, they're starting to interact with other children in a primitive play kind of way. And that's usually important because, we're social creatures. That's really important. And if you think about life, all really, we want to interact with other people socially because life is just a series of invitations.
For a man to be alone.
Yeah, it's not, it's not, we're not intended to be like that. And so word development's really important. Let's talk about the different types of speech therapists that you can go to because, there's early steps referrals, which is a government-funded program, and then they will come in home, although they came in home a lot more before COVID, and I think now they're doing more telehealth. And then there's private speech therapy. But I want to cover those different areas for parents to understand.
So like you said with early steps, it was exactly what I was going to say is they used to provide a speech therapist to come into your home and they would do more of that parent coaching model. But now I think they've moved to more virtual just because there's such a need. And so many places have huge long wait lists, which is a whole nother topic. But now I think they're so overwhelmed with referrals that sometimes they're just sending like a developmental specialist into the home, not even a speech therapist. But it is something that families have access to, and it's provided by the government. I think up until 3, or maybe don't quote me on that.
It's
okay. And then there's private therapy, which is what ring therapy is, but that's where you can go out and it's one-on-one therapy. So that's the other thing with fiddlers is there's also programs where you can go into the school with fiddlers, but that's more therapy in a group as well.
Explain fiddler versus early steps.
So fiddlers, I think, is for 3-year-old and later. Is that right?
I think so.
Okay.
Yeah.
And then early steps is for above
3.
that. Yes. Yeah. But there is then private therapy. So that's going to be one-on-one therapy. And it can be either in a clinic or there's more and more, at least speech and language pathologists that are having their own private practices where they might come to the home or you can go to their office and that's more one-on-one. And that's what I think works best for the biggest, quickest amount of growth in the shortest amount of time is that one-on-one because you're able to make that relationship with the child, all the things that we kind of talked about. And also a good private therapist should incorporate that parent coaching as well. So there's private therapy that way, or there's outpatient, which is at a hospital, in a hospital setting that you can go to as well, which is normally great with quality, but again, they have these huge long wait lists. So, what I would recommend for families that are looking for a speech therapist is to kind of shop around and see which therapists are more readily available, because really the earlier you can target things, the more success, and again, in a quicker way. But the good thing about Florida specifically is that the Step Up program can provide those therapy services that are needed if you qualify for ages 3 and up. So if you have a child that has a speech and language need, if you have a diagnosis from a pediatrician, normally what we can do is we'll write up a plan of care if a child really needs services, and then we consult with the pediatrician and make sure everyone's on the same page. Once you have that plan of care, you can apply for that Step Up scholarship. It's called Unique Abilities, and that will cover the cost of services. And they just have to be 3 years old in a private school, so they can't be in a public school.
That's good. That's good
But that is a great resource. It's one of the only resources like that in the nation. So it's really something that we try to encourage our families, even ones that don't seem to need, assistance financially. We tell them anyways, because it's just such a great resource. You can use it for therapy services or anything educationally. So that's another way to access services as well.
Yeah. Now, is that just unique to Florida? Is that just a Florida program?
Yes. So it's called the Step Up for Students, and they have a bunch of different scholarships. So they have one that's for private school kiddos. They have
that
one.
the McKay?
They've changed the name, but I think that one's called PEP.
Okay.
And then there's one for homeschool. And I don't know the abbreviation for that one. And then there's Unique Abilities. So that's the one that I'm talking about. They have to be 3 years old in a private school. So most of the time, kiddos that are in a preschool, that's a private school.
Pre-K3 is always going to be private.
Yes. Yeah. And if they're 3 by that year, so they don't have to be 3 at the time that they apply. They just have to be 3 within that year. They can apply, and most of the time they'll get it. They can apply with that evaluation that's signed by a pediatrician and have access to those funds, which is a huge blessing in this state, and it is unique to Florida. So,
do you think that there's any online programs that are beneficial? There's always the discussion.
Miss Rachel, that's one that we hear about a lot. I think that is something that we specialize in, is teletherapy services, but with those younger kiddos. And just as a mom, I encourage families to get off the screens.
Right.
I think that's, again, a generational thing where we're trying to keep them engaged, and nothing against Miss Rachel, but it's something that parents feel good about, like, oh, well, at least they're watching a speech program.
Right. And then again, that goes back to what's the parent's endpoint?
Right.
To
exactly. And parents need a break sometimes, but there's other ways.
Yes.
Yeah, there's other ways. So I always encourage for families to take a break from the screens. And I'm like one step further, that I hate for my kids to even have toys that light up. Like, let them engage with things that are more functional.
Mechanical, functional. And
I mean, we have this huge
toys.
ADD problem now with our generation, because we're just so overstimulated by lights and screens. So, and we're just bombarded with things that help us to stay, busy all the time.
Right.
So
instead of just boredom.
Yep, exactly. Which is so good for kids to be bored.
Great for kids. To drive them into, the monotony of boredom drives you into creativity.
Right. And I think, kind of going back to what you mentioned, is families are trying so hard to make their kids into certain things, like make them into, super smart or super high, scores on tests or whatever. But kids really become what you are. So if we are engaged all the time with our phones and with our computers, or if we're always having to have the TV on, that's how they're going. That's what's going to happen with them.
We're the role models.
Yeah. So, and they learn from what we're doing, not always by what we say to them. No. So, I mean, what we say is very important, but
back it up with what we say and what we do.
And what we do, because that's what they're learning from. So, like, if, for example, like if you want your child to be a reader, then you show them that by you reading. Then so that's just a little.
Well, that's huge, and that's what I tell parents: is you're the role model. Your approach to handling the activities of daily living, to how do you handle the stress, is
that goes along with the choking that we spoke about. Like, if a baby sees you freaking out every time they gag, then of course they're going to freak out when they're eating.
Right.
So it kind of goes right along with that, is we have to be the role models, which is a lot of pressure, but it's so rewarding. But just realizing that they learn from what we're doing. They react, based off how we react to things. How do we handle stress? That's how they, learn. They learn that from us. So
the beauty of parenting is that while it is a re-engagement of our own childhood, we have the opportunity with our age and our experience, and if we apply that approach that, okay, I understand my mom and dad gave me good things, they gave me bad things, and these good and bad things are generationally woven into the culture of the family. And I have an opportunity now to stop what I didn't like.
Right.
And it's an uncomfortable experience to own that I always help my parents and my family. I'm a very calm person, like very calm all the time. You put my 8 kids around me and I scream.
Right.
And that's not me. It's never been me.
Right.
But, nobody can take me to the edge of my personality.
Right.
Which are the parts of our personality that we like to keep hidden.
Yep.
Except for our kids.
That's why we become so much better when we have children. Because we're aware of those things. We're aware of the things that push us over the edge, and we have to, use that prefrontal cortex to be able to problem solve those things rather than just running through our limbic system all the time where we're just reacting instead of noticing how we're feeling about things and handling them appropriately, and then teaching our kids how to do that.
How to handle it. And it's okay if you've messed up. And that's what
absolutely, That's the other thing I was going to say is I say all these things, and do I every once in a while freak out when my child doesn't want to put on, only wants to wear her Elsa dress? Like, yes, I do.
Yeah.
But it's something that's the beauty of parenting too, is it helps us to become so much better in that way, and gives us an opportunity to make these little great humans as well.
Right. So. And then they can, what I tell parents is, even if, you've done terrible things, you've done terrible things, but if you can own that space and truly own it, because when, like anybody that we have seen, when it's a fake apology and when it is like, I've really sought out why I did this. And then you give an authentic, from the heart explanation, not just an, I'm sorry, I'm sorry I hit you.
Like roll my eyes.
Whatever. Yeah.
Yes.
So, but it's a mic drop moment. And what happens is you rewrite the past. And now the child says, it's safe for me to say, I did that, I was treating you really bad to a classmate, I was treating you really bad, and, that really didn't feel good. And I know it was my own insecurity because I thought your hair was so pretty and I don't have pretty hair, or whatever it is, it's usually something in a comparative mode that
is so funny, because that's something that I feel like isn't taught, is you are allowed, especially when you have a parenting style that you want your kids to be disciplined, that it's hard for families to know that you can apologize to your kids. It's okay.
Huge. You need to.
Yes. And it's so good for them. You do not have to be perfect all the time. You're not expected to be perfect all the time. We do the best we can with what God gave us. But when we make mistakes, to be able to sit down with our kids and say sorry, that's such a great moment for everyone, for you as a parent, but also, just like what you said, it makes them realize that it's okay for them to say sorry. To other, and it's okay to make a mistake. Life is about mistakes. We make mistakes every single day. And that's something that I tell my kids all the time when they get so frustrated when they, drop a glass or something. We all make mistakes. What matters is we try to do better, and we do better next time. We try to fix it by saying we're sorry, and we do better next time.
Yeah. And you might have seen mommy's face look like, but that was just because nothing to do with you. It's just I have to. It's another step in my day, and that kind of frustrates me. But that has nothing to do with you. So I'm
trying to be better at that. Like saying that to our kids too is a huge thing too.
So they can see that it's human and experiment. Which is great, because again, going back to what are we doing as parents? It's how are we going to get them to 18 years old, and it goes beyond 18 because they need our help beyond that. But they can always pull the adult card at 18, and we have to step off, or we can have a restraining order against us. We don't get to be mommy and daddy like we were before. But our job is to get them to become productive, to become part of a community, to communicate well. And there's no, I want to make you happy as an endpoint. There is no, I want you to go to the best school.
Best friends. Yes.
It is, how are you going to go into the world? And so
be productive.
Learning how to be human in a relationship is really big.
Yes.
I want to close on this one thing. Do you like Steve Martin as a comedian?
Oh yeah.
Yeah. Okay. Did you?
Father of the Bride?
That's a great movie.
Okay, yes.
But this is when he was a stand-up. So this is back in the 70s.
Okay.
And so this is one of my favorites, because he was very philosophical. He was a philosophy major. So I love his humor. And he says, apparently he was doing a show in San Francisco, and this is on his, his album, this is before he made movies. And And he said, and apparently somebody brought a child to his show, and he said, "Oh, you brought a baby. That's great." He says, he goes, "You want to play a joke on your kid? Here, do this." He goes, "Teach them to talk wrong." So it's their first day of kindergarten. They have to go to the bathroom. They raise their hand. The teacher calls on them, and the kid says, "May I, Mom, a dog face with a banana patch?" Classic Steve Martin, humor. Of course, he would never do that, but I just love that. Like, get that kid out, get that kid out of here, give him a special test. Yeah,
a special test. Yeah, right. That's what would happen now. Yeah, when really they're on a whole nother level cognitively because they're able to make jokes.
Yeah, but I love that. May Mom, a dog face with a banana patch. Yeah.
I love that.
It's great.
Hilarious.
Well, thanks a lot. I mean, we've run a good hour
me.
here, so thank you for coming in. And you're a speech therapist here in Southwest Florida.
Yep.
You do telehealth.
Ring therapy services. We go in the homes, in schools. We do teletherapy services. Focus on the family dynamic and building rapport with kids, and looking at the child as a whole. So.
Now, is your license structure like I can't practice in another state? You have to be by state.
So you do have to. We can do parent coaching in any state. So that is something that we actually do parent coaching with. I have a couple friends in Indiana that needed some advice, so we do parent coaching there. But we do have to be licensed to provide speech and language services
in that state.
Yes, in that state. So we have therapists.
Even through telehealth.
A small team. Yep. Even through telehealth.
Yep.
Have to be licensed in Florida. So.
Great.
But yeah.
All right. Well, thanks a lot.
Yeah. Thank you so much.
Right. Thank you for joining us on the Dr. Thornburg Wellness Podcast. Come for the science and common sense. Stay because it works.